Let's go, Junichi. Byron, come on, let's go.
Yeah.
Push.
Yeah. Let's do it.
Oh, my knees. Welcome to Connecting Strength and Conditioning. My name is Wayne. This is John. We're both hands, but we're not related. But what we are similar is that we're both certified kinesiologists and we're both practicing in our field right now.
Yep. So today we're going to focus on preventing squatting injuries and identifying techniques that will improve your squatting movement. And also we'll be looking at enhancing functional mobility of the squat.
Okay, so hopefully at the end of our lesson today, we'll be able to compare the anatomical differences between the deep squat and the partial squat. Second objective is that we'll be able to list two commonly seen muscular imbalances in the squat. And then number three is that we'll hope that you'll be able to perform the Mime squat, which is a functional feedback tool that you can do at home.
My colleagues, Byron, Junichi, and Rokin, and today they'll be showing you common mistakes during squat movement and how to rectify these problems.
Hey, Junichi here. As a researcher and squat biomechanist, it is critical for me to analyze and be able to utilize the best evidence-based research that implements my athletes in order to improve their performance and results. When looking at squat mechanics, we should pay careful attention to the depth of our squats. Remember, one of our learning objectives is to be able to recognize the anatomical differences between the partial and the deep squat and their implications for injury. I want to discuss previous literature of squatting technique from Olympic weightlifters and compare the differences between the deep squat and the partial squat. So in a systematic review by the researchers Hartman and his colleagues, the researchers claim that half squatting, which is 80 to 100 degrees, so right here, about 180 degrees, when I get down to 80 to about 100, that is not good and that is not recommended due to the turning point being initiated in the knee joint amplitude. This will have the highest patellofemoral compressive forces and the greatest compressive stresses. So if I'm at 180, you want to go down to your deep squat and not kind of be doing these partial squats at 80 and 100 degrees. If you would like to read more on the study, here's a link below by Hartman and his colleagues done in 2013.
The partial squat is a subjective term that can be broken down into three squats: the parallel back squat at 60 to 70 degrees, the half squat at 80 to 100 degrees, and the quarter squat at 110 and 140 degrees. Regarding the injury pathology of the squat, tibiofemoral shear forces can cause injury to the cruciate ligaments, while tibiofemoral compression forces can cause injury to the menisci and the articular cartilage. The literature suggests that roughly around 90 degrees, or 80 to 100 degrees, of knee flexion is the angle of highest compressive and shear forces on the knee. Of course, there's been extensive debate on the topic of squat depth. In a literature review by Escamilla in 2001, the authors suggested that for athletes with healthy knees, performing the parallel squat over the deep squat is recommended due to the purported injury potential to the menisci, cruciate, and collateral ligaments. However, in a systematic review conducted by Hartman and colleagues, over 164 papers were analyzed in order to determine whether squats with less knee flexion, which are half or quarter squats, are safer than deep squats. What the authors found was that the literature that did suggest that deep squats are more invasive did not consider the wrapping effect, which are changes in force dispersion as the femur joins the patella in a descending squat angle. As seen in the image, a greater surface area between the femur and the patella exists below the 90-degree flexion angle. Due to this effect, Hartman and colleagues concluded that compressive forces on the knee actually decrease after 90 degrees, due to the force dispersion. Furthermore, the argument could be made that partial squats can be more stressful on the knee due to the fact that a higher load of weight is often used to compensate for the limited range of motion compared to if someone were to perform a deep squat. Based on the highest quality of evidence, in this case, a systematic review published recently in 2013, we conclude that deep squats are just as safe, if not more safe, than partial squats. The Escamilla study proposed that deep squats should be avoided due to the possibility of meniscal, cartilage, and ligament injury. However, Hartman and his colleagues suggested that claims are unfounded provided that the functional movement technique is learned through expert supervision.
For a second learning objective, we have Rokin here, who's going to demonstrate what happens when one has weakness in their glutes and the further muscular complications that will occur from it while you're doing the squat.
An athlete who has weakness in their glutes will exhibit a lean forward stance or posture during the eccentric lowering phase. In looking at the kinematics of the trunk and the lower extremities during restricted and unrestricted squats, forward leaning during the execution of the squat increases the risk of ventral flexion of the lumbar spine. To minimize the magnitude of this ventral flexion of the lumbar spine, it is necessary to induce a lumbar extension maneuver. An athlete who has weakness in their glutes will also exhibit weak extension of the hips, specifically the gluteus maximus, and improper eccentric glute control, in which the lower back will compensate for the squat movement. In the study by DeStefano and colleagues, 2009, gluteal muscle weakness has been associated with lower extremity injury. Surface electromyography was used to quantify the activity level of gluteal muscles in 21 healthy and physically active subjects while performing 12 exercises. To activate the gluteal muscles, the best exercise for the gluteus medius was side-lying hip abduction, while a single limb squat and single limb deadlift exercises led to the greatest activation of the gluteus maximus.
In the most common case of muscular imbalance, we're going to have Byron here demonstrate what's going to happen when people squat with tight hips.
So a lot of times when people squat with tight hips, usually when they use a weight, they use something like a barbell. So in this case, I'm using a dowel. What they would do is they put it over their heads. And usually most times people like to squat shoulder width apart. And so what happens is in most scenarios that when a person's coming down to squat, there's a certain position where they're back straight, and all of a sudden, because of their tight hips, what they do is they have a tendency to lean forward and overcompensate when they're squatting down. So they feel like they're getting past to 90, getting close to 90 degrees or past 90 degrees, when really they're just leaning forward. At that time, especially having a substantial load on your shoulders, what's going to happen is that this weight is actually going to push down and add excessive pressure on your spine. And so if you're working with a client, the tendency is that they're going to become injured, especially in this type of position. So what you're going to do is when you're loading somebody, you want to make sure they come down to position. And if you notice is this as far as they can in this upright posture, and all of a sudden they start leaning forward, you want to stop them, because a lot of the times they're going to start arcing their back, and that's going to cause a lot, like I said before, it's going to cause a lot of excessive pressure and can lead to injury. So when you come up, make sure they're coming down, straight posture, chest up, head up, come down as far as they can. Then you can assess them on how far and make necessary adjustments as usual, and you come back up, and that's how you can assess a person with tight hips.
Wayne is here today to help us demonstrate the Mime squat, which is a great tool you can use at home just to see what type of muscle imbalances you might have specific to the squat. So you can join us, you can pause the video, and just follow along how Wayne is doing the Mime squat.
Squat, basically, it's a regular squat. You're just going to face the wall, okay? So what you want to do is keep your body neutral, arms up, squat against the wall, try to get nice and close to the wall, and squat down, okay? So if you have tight hips, what you're going to find is that you're squat, and your hips going to fall forwards, you're going to have a lean forward posture, and if you have weak glutes, our knees are just going to kind of bump into the wall before we get towards full squat depth.
Here are a few more useful videos of tests athletes can use to learn what else may be limiting the functionality and mobility of their squat.
We have just covered the Mime squat. We have covered all three of our learning objectives for this exercise. Now, you're not going to be able to squat like Rokin over here with the poor posture and just bad form altogether. And instead, you're going to look like Wayne, an absolute stud who could squat and will probably have more success in life than Rokin. Well done, Wayne. You're the man.